hello, hello. Welcome to another episode of PodcastDX, the show that brings you interesting topics, interviews with patients and providers, and the latest medical news and research, and more. I'm Lita.
I am Ron, and I have a feeling this is going to be an interesting episode.
Yeah. And I'm Jean Marie.
We're the hosts of PodcastDX. On today's show, we are discussing silicosis. Silicosis. Yes. I said that.
Yes, and silicosis is one of several occupational lung diseases.
Sure, like you think about like black lung with coal miners. You think about, I'm going to say dirt lung for farmers, but I don't think that's what it's called.
So what actually is what we're going to be talking about? I love this word.
Yeah, it's
Pneumoconiosmicroscopic silicovolcanoconiosis.
Or silicosis.
Okay, we'll stay with silicosis.
It's one of like the longest words in the English language. Is a lung disease caused by the inhalation of silica dust.
Okay. Well, silicosis actually it's a irreversible disease with no known cure. And according to a 2022 study from Biomed Central, men account for over 95% of deaths from silicosis. However, there is some good news. In most cases, it is preventable.
Right. That's the good news.
Yeah.
We keep saying silica. And you're probably asking yourself, we're saying silicosis, and you're asking yourself, what is silicosis and what is silica? Silica, or silicon dioxide, SiO2, is a natural mineral. It's the second most in the Earth's crust.
Yeah. Okay.
So I don't know what the first mineral is in the Earth's crust.
It's the magnesium, iron, and silica combo.
But silicon dioxide is number 2.
Okay.
And it can usually be found in sand, clay, and rock.
Okay.
Individuals who work in or around quarries, potteries, foundries, or with artificial quartz aggregates such as quartz countertops, so the manufacturing or installation of those products, are at a higher risk of inhaling silica dust.
Also, those working in the dental profession with implants, bridges, or veneers need to take precautions to avoid inhaling silica dust. Wait just a minute.
Oh, boy.
Huh.
Yes.
Those working in the dental profession.
Who are being exposed to it on a daily basis.
So
the
what?
dust.
Okay, but how many teeth do you have?
Yeah.
30?
What?
How many teeth?
You're like,
32.
I don't know. How many teeth do people have?
Yeah, about 32.
Okay, so if you're going in to have work done on all of those teeth.
But you're not.
Yeah,
okay.
You're inhaling it because you don't have any option.
No,
Your mouth is open.
Okay. First of all, so it's the silica dust from manufacturing like bridges every day and filing those down, and you're around the dust all the time. That can be problematic if proper steps to prevent the inhalation of it are not taken.
And you don't think maybe putting a little filter at the back of your mouth to
No, I think that would make a lot of people gag, but they do more frequently now when you go to the dentist have like a little
vacuum going?
Well, they usually have a vacuum suction. They also are cutting the dust down by adding water to your mouth, and then they might have a secondary vacuum air filtration device that is also in front of your mouth.
Okay.
So they are taking steps. That's the whole point of this is, here's what it is. This is what it causes. What can we do to prevent it?
Yeah,
I actually have a solution to that, but maybe I shouldn't share.
Okay. Oh, boy. Is it an unpopular solution?
It probably would be.
Okay.
All
right, let's get back. Actually, what I want to say is that the dental profession is probably one that you don't think of. However, because of what we're talking about, the different professions that I'm about to mention are ones that are more prevalent, which includes firefighters, construction workers, well diggers, and landscapers, and miners. Those that actually work in mines, not young kids. Okay.
Okay.
Sorry, I had to put that in.
Yeah, I see that. Uh-huh.
And anyone working with slate, brick, or concrete, they must take precautions to avoid inhaling the silica dust. Okay. And I think that's the key, even going back to the dental, all joking aside, it's the dust more so than, just being around it.
Right. Okay.
Right. Yeah. Well, because the problem is when you inhale it.
Right.
Yeah.
Okay. And what about, you didn't put mechanics here. Did you know that mechanics use silica to sandblast parts?
Well, I think we're going to talk about sandblasting in a second. So
okay,
let's
then
include
we'll
mechanics
just go
in there.
back. Okay.
And then also like asbestos is another occupational disease.
Right.
So it's similar but different. But and I would think mechanics are also exposed to asbestos. And,
right.
Yeah.
Well, those individuals using sandblasting equipment, look at that, it's right there.
Yeah.
In construction.
Amazing how that happens.
Or in the production of denim jean material, graffiti removal, restoration work, or elsewhere.
Such as mechanics.
Auto
mechanics, diesel mechanics.
Yes, we definitely used, yes.
Yeah, okay.
Blasting.
Sandblasting, right. They should take precautions to avoid the inhalation of silica dust. We used a hood, not over our head.
No, but yeah.
A hooded,
right.
What do they call that? A hooded.
Yeah, hood.
Okay.
Yeah, so.
And it had a vacuum set up to it, so it vacuumed it out. So I think I'm safe.
Okay.
But anyway, all those people should take precautions to avoid the inhalation of silica dust and be adequately trained in the use and wear of respirators or other appropriate personal protective equipment, like the hood. Employers should provide employees whose work involves exposure to silica dust health monitoring. So how does are we going to talk about that?
Yep.
Okay.
So before we do, though, I'm going to have to play Debbie Downer here and add that the silica dust can remain in the air for hours.
Okay.
Not just when you're working on something.
Okay.
And when you're done, it's over.
Right.
That dust can still remain, those particles can still remain in the air.
Like COVID.
Okay.
So caution should be taken by anyone working in and around dust-producing activities, and by anyone entering an area where silica dust is produced. This may include wearing protective clothing, wetting dust as it forms, vacuuming, and dust-collecting equipment.
Okay. And according to the American Medical or Lung Association, symptoms of silicosis may include, like difficulty breathing, coughing, and sputum production.
Yeah, and as the disease progresses, symptoms may mimic those of bronchitis, and they may include night sweats, fever, fatigue, a persistent cough.
Okay, so it's like, because your immune system is actually what is like one of the mechanisms of this, and I shouldn't say. So like you're inhaling the dust, your macrophages are absorbing it just like they would do for fungal, virus, other particulate material entering your lungs and surrounding it to like capture it so it doesn't go on to other parts of the body. But when you have so much silica coming in, it's going to be like clumping together. It's kind of like adding, if you were to add like split peas to raw dough. Okay, so like you add the hard, dry split peas to the dough, but the more peas you add, the harder that dough is going to be to work. It's not going to work. It's going to become stiff and immobile. So like that's like the fibroids that form.
Okay.
And so then it's hard to breathe because your lungs become like, stiff. They can't flex. And that's the whole purpose. They're supposed to be like balloons.
Okay.
And instead of like balloons, they're, cemented in place and they're full of junk. So,
Got it.
Okay. There are several tests. As we said, healthcare monitoring is important for people who are in industries in which there are occupational lung diseases. And your health provider may use some of these tests to help reach a diagnosis. And you might get, for example, a starting point might be a chest x-ray. And then like chest x-rays on a regular basis to monitor to see if there's any progression or if there's any accumulation or nodules forming. They might use ultrasound, a lung function test, a CT scan, bronchoscopy, or even take biopsies. Okay.
Individuals living with silicosis may be more likely to contract tuberculosis, COPD, or lung cancer.
Well, I guess, yeah, and you wouldn't contract it, but develop it. Yeah. Okay.
So, what I want to do right now is talk about the different types of silicosis. There's actually 3 of them. You've got acute, accelerated, and chronic silicosis. So with acute silicosis, what that is it's silicosis that stems from short-term exposure, weeks or months, say, to a significant amount of silica dust.
Okay, so short period.
Yep.
A lot of dust.
Okay, gotcha. Okay.
Then there's the accelerated silicosis that stems from a more extended period of exposure to the dust, but say less than 10 years.
Okay.
And then chronic, which is caused by exposure over a more extended time period. So let's say 10 years or more.
And that's kind of what I picture, like when they're talking about individuals with who have developed silicosis from like working, installing countertops.
Mm-hmm.
If that's what they do for a career,
Yeah.
then they might have chronic by the
Long-term
time
exposure. Right.
by the time they retire.
And if they're not aware that can be an issue. Yeah. Your healthcare provider may recommend that you use a bronchodilator, supplemental oxygen, or even attend pulmonary rehab to help you when you're living with silicosis to make your life more comfortable.
But you also may want to ask your healthcare provider how, say, a healthy diet or exercise, abstaining from smoking, and even getting your annual flu vaccine, how that can help you to live a more comfortable life with having silicosis.
Okay, sure.
And in order to avoid having the silicosis, once you've got it, the only option is a lung transplantation. And that's really the only option for whom the disease has progressed.
Oh, okay. For those, yeah. Okay. In whom since silicosis is irreversible, prevention, as we've said, is a key.
Yes. And I was thinking when you were talking about acute silicosis
Oh, yeah. When we're almost
or
talking about-
accelerated, which of those two accounts for the people that worked 9/11 for the months after
I mean, it's months.
the cleanup?
So I'm guessing that's acute. But they're firefighters, so that might be chronic because it's not a limited exposure.
Okay.
And I know there are new tests that firefighter, and maybe not relatively new testing that firefighters can get to help identify whether or not they have markers for certain cancers, and that might stem from their work because it is you're working with a lot of toxic things that are being aerosolized, and yeah.
Well, I heard recently a firefighter passed away recently from 9/11 related lung disease. And they had a GoFundMe set up for that person. I thought when we talked to Dr.
Well, they were a volunteer firefighter, so I don't know what the circumstances are there.
Okay. Because I thought there was a fund set up to...
I don't know.
Okay.
We would have to ask about that. Yeah, I know who you're...
All right.
Yeah.
Well, I guess that wraps up this episode. I got nothing else. If you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com. You can go to our website, PodcastDX.com. We're on Facebook, YouTube, Pinterest, Instagram, TikTok, and...
We're here at
Twitter, X, or home.
Stop by for
coffee.
Coffee. Coffee machine's broken, by the way. As always,
So
please
bring a coffee maker.
You got to bring your own.
BYOC.
Yeah. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.